Long-term treatment for under eye hollows? I am so tired of these ugly tear-trough hollows that make me look so much older. My dermatologist recommended Restylane injections. It's cost beneficial for my doctor if I keep getting these injections, but not for me. I would rather pay a lump sum for something that will benefit me longer term. What would you recommend? I'm 25 years old and I have never had any cosmetic surgery or injections. Please see pictures and thank you.
Thank you for your question. You're 25 years old and you're looking for a long-term solution for the under eye hollows. You mentioned in your question that the dermatologist recommended Restylane injections and that there is a financial incentive for the dermatologist to have you return. And so naturally you want to do something that's more long-term benefit. Well, as a cosmetic oculofacial plastic surgeon and specializing in this area, I have a lot of experience with the tear-trough area and also being boarded in facial cosmetic surgery and doing a lot of facial procedures, whether it's cheek implants, chin implants, facelifts. I have a lot of experience with different modalities over the 20 years I've been in practice. The fillers, the hyaluronic acid fillers, have actually provided a remarkably unique benefit for an area that used to be very frustrating. I come from a time when the tear-trough area, we would actually select only a certain small percentage of patients who would be candidates for a permanent silicone implant. So we've come a long way with the benefits of hyaluronic acid, and certainly what your dermatologist recommended is within the standard of care. There are certainly some things you can learn about the long-term benefits of hyaluronic acid or the longevity of the hyaluronic acid. We see patients who we can inject with hyaluronic acid alone and see the results last for 6 months, a year. So there is some individual variation as to the longevity of the hyaluronic acid, but something that I will share with you that we've been doing in our practice is we've been combining our hyaluronic acid with platelet-rich plasma. Being very active in the regenerative medicine field as it pertains to our specialty, for example, we're using platelet-rich plasma combined with acellular matrix for hair loss, and we're using this combination for a lot of volume correction in acne scars as well. So for the tear-trough area, the reason why I started doing this is that platelet-rich plasma actually stimulates your body's own vascular growth factors and collagen. Platelets are the cells in your blood that are necessary for healing when you get a cut. So what we do is we draw your blood, we spin it, and we concentrate the platelets and the plasma that is carrying the platelets so that we can essentially mimic the healing response to restore quality of skin and volume. So there is some more long-term permanence to this type of procedure in our experience, because what we do see is a real improvement in the skin quality. When you look at yourself in the tear-trough area, much of the under-eye hollowing is also due to your skin type. Your skin is naturally very thin. You're only 25, so you don't have, as of yet, age-related changes, but the skin quality is very, very thin. So I find that in selected patients, I would actually combine PRP with hyaluronic acid rather than just hyaluronic acid alone. So that's a concept for you to think about and learn more about. But again, at this time, the hyaluronic acid fillers really have been quite a benefit for the selected patients that it's appropriate for. So I think that You have to find a doctor that you trust, that you feel is not going to be driven by a purely financial incentive, because trust and maintenance is very important. You know, when you're dealing with something that cannot be surgically treated definitively, then there is still a lot of things that we can't do as well surgically that we can do very well with injectables. So there's a balance. And so I would say that find a doctor you feel very comfortable with. I would say someone who gives you a lot of time, spends a lot of time with analysis, and understand what the risks and benefits are. But I hope that the information about the PRP is helpful in your education process. So once again, I wish you the best of luck and thank you for your question.